Hello. I did it for your umpire. Yenyamene ya bankase. Ade nyina so tumfo. Aja konkron na nwumre nso yeda wase. Yeda wase so waka ye ho no abo ye ho ban. Afri obonsam enhwehwe ye ne so so ye nyina mu.
Amen.
Na nwumre nso moja de ye mu afuru sane na katrama abodwe mu. Ayeye nka wudin da.
Amen.
Yeda wase. Nyansa nim dia odi adom nkrofo. Na nam so nti odesa enhwehwe asi ho. Se na wotwe mu nyina obekasa kire wo nkrofo. Ewo ya pomuden ho se de be ya ibetuma tenase. Apomuden mu na atumi asomo enigye ene wodomu. Yeda wase da.
Amen.
Yeda wase wako a ene obedi adesua animu. Etu ne hwa won sasronko. Se nyansa ne nimde bia wo hia de bekasa kire wo ma. Se de be ya no ye betenase. Na rade ya somo wo ye no yeso se fadom ne da.
Amen.
Yeda wase sa won krofo wanye pesemi nkominya na waba se de wasua wone won krofo ebeche yesel se ka won ho da.
Amen.
Wa desua mu no bibia aka won a onya nduru ho no yesel se fadom won da.
Amen.
San se waye we nti yesel se hira won na wabusuafo nyina anwumre nso yesel se beka ye ho na ye na yeti adesua nyina so yenti ngu asopem na yentumi nsua ade emfrem na yemfa mo bra ebetena se na boaye apomudene ho. Saa nso ne yesra wo se wana obeti adesua bi akire da foforo ewo abefo mfidie ahodo so nyina hira won saa pepepe na onya adesua mu chefa na wonfa mo bra entena se entwen wo maye tosom yene no. Yesra wo se bra be hira enwumre na beka ye ho na be kire Kristo Yesu din mu ene ye bompaye. Amen.
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 Eda Mr. Ponsan ase. Sabre de yadru so no yebefre yankasa yeba yenana Michelle Chewa na afe what the yen key text no abre ebra yenu ba Irene so ACC no ho na ode yen theme song no so abre.
Today, our scripture reading will be taken from 1 Corinthians 6, verse 19 and 20. And it reads, Anase munim se monipadria ye hom konkron a awo mumu a monya free na kupon ho no asording na moni moho na woto mo aboding enti monshe onyankopon enmonyam monipadriamu. Amen.
Amen. Amen.
Michelle asinyame nhyira Michelle. Afi dedi ho no yebefre yenua Irene na afi odi theme song no abrain quickly.
Your theme song no SAH 499. What a friend we have in Jesus. What a friend we have in Jesus. All our sins and grief to bear. What a privilege to carry everything to God in prayer. Oh, what peace we often forfeit. Oh, what needless pain we bear. Oh, because we do not carry everything to God in prayer. Amen.
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 Irene, that was the Drew so no, yebe shall say with our presentation. na ansana no megusu akai ye nyina se de ye no sabre program yi stream live ewo Facebook any YouTube and until you are the phobia almost person or joining all through those social media platforms na you bet me at the links and also send the one. Oh yeah, sabre but the address so no yen presentation for tonight. Said di kan enya no entia no and the topic or say medication adherence. Se ye fa yenru said ye was say si efa no pepepe na aboaye na nipa ene obedi animu na wama yen saa desuan no onye ohoho ekwan bi so esan say yemudodo na asafuma na yenim no do na nim ne say Dr. Asare se mre bi a atwamu na ono ena na ye Cincinnati Asare ye health and temperance leader ena ofri ye nchen ekoye. Dr. Asare a pharmacist by profession. Now, wakwadre ewo enromusu ye minim say also specializing in BBFN medication therapy management. Ekwan see manage yenro na boaye esa yare no enyina. Waye adwuma ewo pharmacy settings so ebebre nti no oyobi a owonimde. Enti ene ye ni je bebre se yenya no we mfimfin na afi oni yen eba beka yenro eho asem eno nti na bra mensa ebre no meja aha anase kasamu no ama Dr. Kingsford Asare na afi ode ene adesua owo no so ede amaye kai se wi a ensemisa enso ebeto aso medam ase.
Amen.
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 Me person me share my screen. Okay. All right. Dr. Boateng, I say introduction. We introduce him to the church. I also would like to take this opportunity to thank the whole leadership. Also for Kusi Yabua. Also for the health is Pastor Yabua. Ope health pay into me school fresh. I'm a bar Cincinnati BCA no. My passion is health. Now also passion is health. Until we had a lot of fun. I do miss the church because of those times now me buy, not your friend a doctor. But I say so can doctor, you have to answer say which one. Say onyame asen ho animonyam wa so no bebre. Enti me danyame ase na me damase say my friend me back. Say me share my knowledge with the congregation. The congregation I miss and love so much. There's not a single day I don't miss Cincinnati. Cincinnati is pretty much like Kumasi to us. Thank you for giving me the opportunity again. But also, my screen and I'm not menka.
Anne.
Okay. Good. Enti ene adia yebe kasa ehono ye medication adherence or medication non-adherence. And disclosure, said Dr. Boateng, I'm a pharmacist, because I know a lot of doctors will talk. So it's important for me to, tell you my background like he did. And this information is not meant for you to diagnose yourself with it or treat yourself with the information you are distributing. Now, I don't expect to be used to the content of this information. Now, the akoto ground man na asa wode akasa sene me kan yin ntino we na wo pa kire ntima akoto ho adruma no yin treat yare sa nti that is important. Now, idea ye person ye start me can say as Christians and as a Seventh-day Adventist, idea a core of our doctrine. I say, yeah, this one is yam sumuno etiba kumpa says stewardship. Stewardship is very important in our doctrine. Now, the concept of stewardship is say, Nia ye wonyina ye rade dia na yen die ye hwaso ekeke. And that includes your family, your wife and kids. It includes your education, your knowledge, your work, your employees, and everything you have. The key component of stewardship is say, if there's stewardship, and I say steward be now he is not held accountable. It is just noise or nonsensical. And the stewardship goes with accountability. And until you make us a tree out being able to say yes, ba ye bebu be biara or the my biara hon akonta. Na no ma ye bebu hon akonta ba akone say our health. It's very important. Aya na bia ye fika krabat and also ye bebu hon akonta. And until I was say yehu. And I yes so where you was ye here ya ho odin ne health and sana yetimi eye sa adwuma no na ehwehwemu kire say ana say it is well established say nipa empom etechma na say in all healthcare interventions na say nipa empom etechma all healthcare interventions it results in provision of medication. And then brebiara nipa epom ebetechima no ewie say omfadru. No two ways about that. Say you surgery na akoye o awo na akoye o bibiara efa unipadua atechima no it results in medication. The problem and the sad part is say it is also documented and established say only 50%. So all the by US here 50% of US population and a fair drew senior I was homofano. 50% the omon fair drew no said the omsifano. And until it leads us to our topic today, which is medication adherence or medication non-adherence. Now say one fa a drone so senior I was a fana and yajuma. One doctor be Dr. Everett Koop, or a US Surgeon General. Was medication do not work in those who do not take it. But to go further, I would say the medication, they do not work in those who don't take it correctly. And it's very important. And until I was said, you who say, you were doctors on my being, you were hospitals are almost very good. Our US, yeah. Now, so they will all amount to nothing if they give us medication and we don't take it. So really, the question may be, say, because of medication non-adherence, what is it? Any are the assertions? Say I'm more drew. Now one funnel, a quiet doctor no a person of funnel. Let's see more drew so fun 100 days. Say a drone bet me a year my power with you when you're home for swa. Doctor and a person when you're home and also Nipeduana was wonya. Just why you often correctly on time, the number of times a day correctly for 80% of the time. So you have to take it correctly 80% of the time. Okay. Now say offer disease stage bit to say infectious disease and I say HIV crowd here and 95% into a case of fire or that. So basically minya home fast wapa just offer no correct 95 days, 95% of the time. Now say I'm fair draw year no ya chemu mienu ya were primary non-adherence and a secondary non-adherence. The primary non-adherence ne say I woku yare woko doctor ho doctor mawaduro and so one see pharmacy ho kra no akofele aduro no and when your friends say primary what they just 1 2 1 more kra na researcher akọ sa problem no primary non-adherence no yen said dan study ni ye bebre enti yen said nim ade potin bebre et say secondary non-adherence no secondary non-adherence no say me yare me ko hunu me doctor wo mamaduro me ko pharmacy ho me ko fele nanso me de ba afie no mamfa no sane ne kwaso ene ne secondary no we na yesua ho ade yie. In fact, me we a pharmacy student me koye program me master a whole 2-year master's program on this topic. Said ye ubesi manage obi a offer dro bebre ne said ye nipa besi afa hospitals betime manage na on patients are former dro. It's a whole program. Na secondary non-adherence na no so wo machemu 2 man fa dro na efisa na me mpesa me fa. And I said, man, Fedro, if he said, no, maybe etigu miswa, na beyond my control. And I said, no, maybe a chichre mea, I'm a man to me, and I'm a person me fadie. Nanso, and sembi eto to me, and unti amama amfa. And only a friend unintentional man said that. I'm a person me fa pa, nanso, and no maybe intimate me amfa. And they were intentional, and they me said that person me fa, and I'm me fa, mamfa. How big is this problem? Asma yeken ne kase pa was and I say time when you one ye pese ye de keke. The ekwaye say this problem is like very, very huge problem. Now I've been fortunate say a friend said the weakest link in the healthcare system. Now healthcare system no fast one yina ye benyano. If we say yeah, fire no senior, what's your fan? Said the mechanic so the doctors are good. Omi atatahe. We are seeing in doctors popping in America no more. And now hospitals and so are popping in also chrome no more. Now so these two things in a couple more. See, I'm for medication now, they are all useless. If we say the mechanic say almost any time oni pedua hu betich mabia no ekowie duru na ne kase a me pa kan say sa problem we across US between depending on what article or literature you read across US between 100 to 289 billion dollars a year, which is about almost 5 times the GDP of Ghana. Very big money. Also about 300 billion. In fact, other studies say about $600 billion a year. 125,000 people and every year. If it's a former draw senior doctor and I say Yariane da omosuno assess omofano 125,000. If you monso sanko actually say we prescribe on us a fairly 4 billion prescriptions every year in America. 4 billion, no million. 20% of these prescriptions, they are never even picked up. And it's a huge, huge problem. Okay. So I think I've gone through this. Intentional non-adherence, no, and as I said that me from a drone. When and
the entire public hearing process is a choreographed Stalinist show trial. They read from monitors.
Okay, so my said that me said that's a me from a intentional non-adherence, no. One fair drone because be a side effect be what madam for akwasi enomo Tylenol or no Tylenol no ni tumu tutu inti ne mekra me so me mfa me de wa said that's on fa because what say side effect be ho. Number 2 reason and from former drone said that's what from drone say yare na won so no wonya hu ensunsun ye bia into who cares. For example, obia oyare blood pressure or oyal blood pressure, but on taking a drobia because onya symptoms bia efa blood pressure no, therefore on take medication. We need another reason a man for said as on take medication. Antibiotics, your man for 10 days, and so no 5 days no send ho atono into a jai dia can go. And after so a fabin so agina say on ti yare no ase. E bibi ti say asthma. So yare asthma, Dr. Bema o enuro mienu. Say truly asthma, ye bema o enuro mienu. Ye bema o inhale na sa asthma ne chiwa no wanom. No what inhale. And obesa ma ba ko e steroid. Na steroid no, so many patients say kasa, what I tell them they say the steroid no and no asthma medication. But kuna won ye na ho ato no de it just to make you feel comfortable. It really doesn't do anything to change the cause of the disease. And yade no ho chichima entene ho chichima bia na de emom ete ho she bibi na say ye ne bibi no ene steroid no. However, se nipa na te ho na say onya asthma attack ne de a on fast steroid no kwa onya asthma attack na no wakofa aduro ba ko na enye asthma aduro no ema na home keke no. In the example say the reason ema na eye say on ti yare na se ena obu hanso a wo ma na aduro obefa bebre ebi say bia wanom ama afedi aduro na tie no anasa aya addicted into obeso ofa more say be obenya mfaso a opeso wonya no. And also etime ema enipa sheda se omfa na duro no wo kwan a e wo se ofaso no so obi nso efa ketua bi efi so suro se obenya side effect ana se opese oye na aduro no eche ema no. There is also a belief system binum to say it is a Ghana tete ho no so obi afuduwa na na se etataya so obi nya heart failure na se na koma ne moyi a etimi man sa nsunsuansui nanso obu ha onya sa yare na instead so obanum aduro no wose abomedua nti wo man aduro na onom kra na wagya atum baabi afa nso ebinum so wo believe bi say enhahama better than abrofuneral no if you say hahama no natural, which is also not true. And ebinum so trust omo doctors and as a healthcare system, especially Mr. Mkan woni sabi adwuma ye nti ya ne other especially akatafo no ekasa because of experience among the system nti ya no monta and trust system no papa. And afen so ne binum so enim say drug companies ne doctors no ko ton room man ko promote nti in the course no omo we ne doctors no, and for that reason the doctor no prescribe are not really what is that's not what he really needs, but because drug company no I win the doctor into no tremano just to make the drug companies happy. For that mistrust into no ebinum so emfa aduro no obu onso wonfa aduro no fi so nim say ofa ebeka no so and also be dependent on it. Ebu onso osro because of experience bi a ni nua bi enya wo emre bi a atwamu nti enu nti no ema no ono nso esuro ese obefa aduro no. Na nea we die opese wofa nanso nsem bi nti no emani ntimi mfa aduro no. Number 1 cost. Number 1 cost of the medication. Into the medication and the board in Biblia enipa no ontimi afford. Therefore onfa aduro no. Ena ayefie enso so unintentional non-adherence. Me pesa me finance duru ha na me refi. And ntitimi so that problem. And accessibility. Bibi ti say obo ha opese okwaje aduro na nso onya car ana ote ebia country bia na ote ba bia yes ofa ba system ne ade nti no eduru ho sa na ebia obu nani aguso na wajai aduro no ekwaje kra. And insurance company so it me denial coverage. Into me denial sa only coverage ontimi so pay for medication or person of fair drone pa nanso sa problems we na wo ha e ma no ntimi mfa drone sene e wose ofano. And no me so ayehu e wo pharmacy no so say doctors ni bi won so a omo they won't be instruction on how to take the medication. Yana ambiguous kakra. Yana very complicated. In fact, utiminya prescription beer. Any point me titrate the whole page to the point a computer in a just all printed and watch and now cancel the patient. And the instruction is very complicated. Patients, what pharmacists in the background now you have to call the doctor and I say too complicated. Now what clarify and into the patient no answer of abaku of family no antiasia no wajai amano ato. And a disability obu ha obaso of fair so package and answer a twa isimono untimi kra enyi ena bia what fair no into de be or try sana it me emano give up. And like I also want like instruction as it's the meme kind. And a polypharmacy is a major problem. And what it is that we take a lot of medication, especially more psych issues. They take a lot of medications. And you are not able to keep track on time I was far away, time out far away, time out far away. And to struggle with this, and a bedroom baby, no jaja, and a depression, so the number one, or is one of the causes of unintentional non-adherence. Now, some problems here, Keno, now what Nebia say, patients no pan say. Yeni I will receiving end na I are for one and it causes our problem. There be 3 branches in and it causes this problem. The doctors contribute to it. Almost the my problem yakasi. Hospitals almost so almost the assembly yakasi. And our patients no almost the ebeka. Now eneka say we are focused on only the patient side. Doctors inside me bet me aka ho asem e wo mre esem.
Doc me pacho na obi sisenka ubetimi a play o PowerPoint na slideshow na mse ayibi e wase on mo click so. Yeah.
Oh, okay. Better now, right?
Yes.
Okay, good. Okay, good. And that's the problem. The thing is, as someone making, it doesn't matter how serious or how say people don't take their medication. Where you study be a hospital be a heart attack. Call hospital. Now your mom in Romy and Sebi. Typicals will be a heart attack. The Mayam said Dr. Ocher and number is and who addition. Now call hospital no the mom your mom starting for cholesterol and your mom beta blocker, which is another medication and mom ACE and I said lisinopril, blood pressure medication and another blood pressure medication mainly for omomanya MI and then starting for cholesterol. Enti womo hospital no be 3 months. 3 months to 6 months. And san frɛ san krofo no. Na frɛ no who say almost 40 to 60%. Former do be a jai. Obo wa jai drone crafa. Enti Yebusa omo de nti a omo gya aduro ne fa. These are the results about from the patients. Enipa be 40 plus, omo so mirefi. Omo mfom aduro no ya no mirefi. Now, if you unya heart attack no one treating here, dey na ebesi obetimi asanya foforo. And they probably told them, but they don't care. Ebinum sisi omo medication is sign. Omo anko fele. Now, this could be a problem with the hospital. Maybe after they are not able to do the transition of care no, because of the hospital. There should be coordination between maybe the primary care and the hospital. No say, hey, Papa, we are some medication and some course any no so at from there. A go high, a medru primary care and Sana said that coordination is not there. Or running out of the medication now. He's an island. Baby oko. Ena MI no so no. Enye se de bia akoma yoya. Bi hu baby enyo yentio forget it. Na waja atum. Ebu onso a wose ai mini fie sese so Ohio say mini Ohio sese metu. I mean, come on. What you are, you can still transfer your medications. Obu onso say I say me ho kire me I'm trying to save money. Ebin some say am side effects. Obi say you're too busy. Ebin say prescription it wasn't working. And ebin say wo mo hwa wo mo hia sadron. And ebin can say they don't like taking it. Now the key or the takeaway point for this slide now say number one solution to this problem is number one, number two, number three. Number one is education. Number two is education. And number three is education. Because they don't understand the implications, the problem has taken into they are not taking the medication. One baby and they think say yeah okay, but in reality it is not. These are some of the problems Emma and Kofoya non-adherence it's a mechanic first. There's a one for medication senior a was a fana a diana eba. So we diabetes. Nasa won't follow insulin and said yes, usifano. So one follow Lesinapro and answer Losat and said Yosifano. And answer what asthma now on fat with steroid and said Yosifana. This is what is going to happen. The disease is a spectrum. You start from one point and then you progress to the end of the spectrum. Nitri say ya rebit say diabetes a bowa. What started what assasia be? There's a one train so it's just a matter of time. And until a dear would the slow progression of the disease and as would be slow, say you're any intimate to America and could do and say over forward. The reason is a diabetes definition is there is malfunction and as a point on the padiani a fast use sugar no and what chama. Now me call pharmacy school na mission disease and as mission diabetes no. Ebi afe na yebe publish the minim organ a what system ni mo a onipadua ni mo a on use glucose as energy source. Therefore, so diabetes e ya koye say onipadua ni bia etache and as a teachma. And this one forward runner. Say yes fana. Even though say we are fine no, at the background no and no may say tina want it. It's just a matter of time. You get to the end of the spectrum and all the things will come on you like that. The whole world will come in front of you like that. So it is very important for you to work with your pharmacist, your doctor, your nurse, to really understand and appreciate what you are going through. So we are well educated. Now, education, I don't mean school. No. Being educated, and say, now you know the consequences of it if you do not take the medication as prescribed. That is the education. Diabetes will affect your eye, it will affect your kidney, it will affect your manhood. So they also know about that. It will affect almost everything in your body. Therefore, so what you see, over forward no send a was so fun. Now you slow the progression to the point that Emra when you be frano, nebia won't yasi. Another disease, asthma. Any panel nam fine. Attack neba or you so inhale, then he will get fine. But at the background, there is inflammatory process going on in the lung. You believe it, it doesn't matter. You don't believe it, it doesn't matter. Whether you did you or not, the disease is progressing. The only way you can slow the disease down is if you take the steroid that calms your body, control the inflammation process, and you have a healthy lung, or your lung doesn't end say in 10. And yes, I will do some point in your life, it will be a mess. Blood pressure medication. So, taking blood pressure medication, unless you have hypertensive agency or emergency, in most cases, one time who say will be the TNA and answer say do some point na a serious nipambeko ER or something. But under normal circumstances, people have blood pressure, they don't know. And it is all queer baby memo Africa. Once a obema di 45, nasa benebema or 35. Even here in America, as a pharmacist, I see people in their 30s, they've lost their manhood because of blood pressure. If you don't treat it well, if you are missing doses, if you think you are okay, but you've been diagnosed with blood pressure, it is just a matter of time. And something bad will happen to you. Therefore, the best thing to do is first understand your problem and work in concert with your doctor. The pharmacists are the most accessible healthcare professionals in the world. 75% of US population, and I'll repeat it, 75% of US population live within 3 miles of a CVS pharmacy. Only CVS. And you can't other pharmacists in the country. Now, everywhere you live, you probably live within 1 mile from a pharmacy. Now, for pharmacists, you can just walk into any pharmacy and talk to a pharmacist. Probably you can do that with a nurse or a doctor. So we are the most accessible people or healthcare professionals. And the knowledge we have in medicine or in medication cannot be compared with any other professional. And medication, taking medication is all the healthcare sit on medication. Whatever will happen, it will end up on a medication. So your healthcare profession that are specialized in medication probably should be your friend. Walk into any pharmacy and ask them a question. The pharmacist will come out, talk to you, because they have planted them in the community. And there's a reason they did that. Because who doctor every time, every time. But these people are trained almost as doctors or your physician. We have knowledge base is very almost like physicians. And every disease outbreak they can explain to you, but no appointment necessary. Therefore, very important for you to be able to understand your disease and take your medication as you should take it in order to get the best outcome of it. Because your health is not yours. Remember, you are a steward and you are holding this for a time. And when the time comes, you will be held accountable. A human superhero was a yes, mama. Wahoka can say or dress it, or bass or a crow be share, na a soon yamusum edding. And into no apomode a japadia and yamedia kutao. So why should you a whole teachma now call a man cells or qua, Urano a bit me busana, one shall be default. I feel so. One reason say reduce functional ability. So one friend said ye wusi fa na obenya stroke. Ubenya heart attack. Na basa wa ho keka ne said ye wusi na nyina no e beto fa. Now I want to tell you something say onipa a yare na busade ye baako. Na emum so onya saa ade na he can pursue everything. Oyarefo abusade se ne ho beto no. Na emum ne ho to ne de a ne pursues and as a normal open e bebre. Awurade hu mmobɔ nam ho ntome. Onka say hu awurade hu mmobɔ kra na mensum yie. Hu mmobɔ mam ho ntome. So if you refer to the Bible, when they go there, they ask Jesus. So obetumi am ho atome and no ne obi a oyare abusade. If you say e yare di hu ba, the hu ma onipa nso ebutu. Enti ebra wo tiase a wo ho odin. Enkrofo bi asua nwoma. All you do say me ma na kan say have kwabena enya den. Yesu se tena ha no atena ho. Yesu so sorry no asori. Eno ani nyamsom. Enti asomre ene bema watimi adi won kwan. Amen. Now another reason also another reason ne medical bills. What no ha benya stroke. Enu ntino won sam na dooso. Medical bills dooso. And after so physicians, we call doctor hona ya appointment na number and na number ni nyina because yare ne buy na wanye den wan so ano sene esitie. And after so no e ba san so be ma wonu na doors because won fa yare and won fa duro na doctor no will be wondering say adenti na won fa duro no enti e bi won be hwehwem na fam say ye hu adekro ne mfa ba duro ba ko kan ne ba ko aka no ho. No akwaba na sound about aka ho na a result say offer a drug and I say polypharmacy, which makes management more complicated. The next you say you end up in a hospital or you end up dying. Another thing is say antimicrobial resistance. Obiko ekoto amoxicillin our markets African market. No one. And as a doctor man I do say for 10 days or for 5 days I know one. What we die. Intibasa na isa drone enye effective bia wo sa woni pa so. Na in fact, a san tre eco community ni na mu so. Into antimicrobial resistance it can spread in the community too. Now, where a case a see a hospital be CDC actually reported it. Obi na onya heart attack and onya heart attack. Ischemic MI. And occur you didn't call year. Into of course, the call no, you share no, and the stents. I say nakuma no, and I say pipe be say nakuma no, say be a moja no bit me upper pass and I say affirm ye, a man I can attend aton kakra. Into a mouse stents no sana, when you pedue, where your friends say, or ya aware as a bibisa. Anytime any padue who say foreign body be abanimuno, nan both. Into the stance in the mouse, sana, say ni perform ni paduan bufu ama, mojana form a cloth. Into a mama drew beer. What it say beya, sa cloth and for money paduan. A bini plavis and aspirin, typical amount aspirin plavis, who found bear 1 year. And the many pay no. On demand 2010 December. May 2011. No, I sound about the same problem. Yes, I understand. November 2011. No, I sound about the same heart attack view. And I'm saying, now what is wrong? Because you're more dre. You share evidence, be was here, be a yamon. I didn't know this guy when you heart attack view. Now the TN say Plavix no enkrofo ha womun emojane entime enyusu ni yi ana say one more genetic polymorphism bi a entime metabolize adroni yi entina doctors no ka say any bi akwa wo that is the problem ana entine wo me change adroni ma no enom change adroni ma ya man less effective medication okwa no asan kunya eventually we will. Okay, So I'm investigating and I'm who say the problem, he was not even filling the medications. So, and to look at the time of course, so how much does a doctor get paid? And to look at investigation, of course, so many attention at team, at demand, all this because one person was not adherent, was not taking the medication the way he should have taken them. And so had attacked 4 times. And it threw the whole Medicare team into confusion. Meanwhile, it was that simple thing. Just take your medication as you should take it. Now, a DNA and some of my a DNA boa me at this year. No, the this year no say problem no soon. If we say, and yet, patients no one and your cause of problem. No, doctors no, and so offer me the was one and a hospital no, also hospitals and so warm from our was one it was our problem. Now, say, yeah, from dear, said him Sikai, no, you have to do everything you can to understand your medication. I didn't know me fast surgery. I mean, fast surgery, a palm bear soon a befast abuame. Time ben, I was a mefano. I was our tears here. No nipa, a tree and the castle on yes, Edman, a man in fan your pharmacist, because they know the medication better. Since the doctor that prescribed, the doctor knows your clinical circumstance, they know your body better, and they understand the disease better than us. We understand the disease, but not anywhere close to your doctor. So the diagnosis will come from him. But when it comes to teaching you, for you to understand your medication, the side effect that you should expect, that way when you get it, you won't get surprised. And your disease, all those combined, that is the pharmacist's job. So anytime I be down, so now fair drew, now on TRC. Now, approach pharmacist, the pharmacist is being paid for nothing. And as a woman, use them. They are very, very knowledgeable. And there's reason that we call some of them community pharmacy. They've been planted in the community to solve community problems. Some pharmacies being so, and I said, some pharmacies being so used to text messages. So when you fill medication and you're about to run a week before you run out, you get a text message that, hey, your medication is almost out. It's time to refill it. There's also a phone call that you can get. You have to set it up with the pharmacy. And this will help you to not forget your medication or refilling your medication. 90-day refills. A lot of insurance companies will offer that. So you can also ask for 90-day prescriptions from your doctor or at the pharmacist. There are so many ways you can pay for your medication, even if you don't have insurance. There's savings card, coupons, Good RX. Good RX is very, very, very effective. It can save you a lot of money. And so look into that if your medication is too costly. There is something we call Patient Assistance Program, PAP. There are certain medications that they are very expensive, like oncology, money, multiple myeloma medication. They are very expensive. Back in the days, one pill was $1,000, one pill. So every month we have to bill the patient $30,000. And there are companies and corporations around that. There's a department in the Humana that go out to look for funds to pay those who pay for those people. This country has help. You just have to look for it and talk to the right person. If you have a pharmacist in your church or a nurse or a doctor in your church, approach him or her, and they can also help you navigate the system in order to be able to get some type of assistance that you need. Counseling. If you are approaching patients, the doctor told me about it. No, I walk away. Whenever you take a medication from a pharmacist, ask all your questions. Make sure you are counseled about it, side effect of it, and the benefit that you should expect, and how long it will take you to get to the timer, you should expect the benefit. For example, omo take care do for depression, escitalopram, lexaprom, who take care about 2 to 4 weeks and some won't benefit. And if the pharmacy doesn't tell you or your doctor doesn't tell you, let's all start here doing a 4 week. Let's allow you're in the depressive mode now. The chances are you will stop. But if you had gotten a counseling from a pharmacist, maybe you know what to expect and when to expect it. So it's very, very important. So we use pharmacists. Pharmacists are readily available to help. Use them. Belief system. Some people have been in this country for many, many years. They still think, say, no papa or Ghana. Now, near a year, this or Texas, and our doctor Bakubisam say, okay, true. They are more can true, no papa or Ghana. What is the life expectancy in Ghana? 50. What is the life expectancy in US? 70, above 80. Okay? Now, and it's our belief system now of free Africa now with the Bahano. Gem, it's not going to help you. And in the end, Fareba, Ewaha, Omuhiesika, Harum Bobosia. And all the research in Ewaha, we are the Akumomo and Umoyusu. COVID the Bayano. Yet it is same baby so bodo Nigeria forward draw a we and a brofon fair drama we are seeing in a yew. Monja brofunindi na yame ewonim dia or dia menipa no mu yusu and beboy. Belief system na for African mumyen jam because I'm Africa for Nasa hospital system na healthcare system we say a better or more better and come president. Anu ma akokodim akokodamfo anase akasefo no omo yare a nkomo maha no munya hiafo no enwo Africa ho enti ha na nu papa wo enti nyame abo no adom ado abeduru ha. Leave that belief system and use this system because this has been proven to be good for centuries and it's working. So we need hospital transportation to go and get your medication. We have online pharmacies. You can use them and they will ship your medication right to your door. Almost every pharmacy has delivery service. So you just call the pharmacy, set it up, and they will send your medication to you at your home. So if you want to into the wuntimi emie cap na enso aye den so a, and also ask the pharmacy for easy cap. Family support. Yare bi to say psych, yare, depression, and stroke, and those kind of HIV. You need your family to help you, or if you are taking a lot of medications, you need your wife, you need your husband, you need your family to help you through it. Family support is also very important in order to help you stay on course and take your medication as you should take it. Yes, I think yade nyina fare baby we aduro so nanso aduro enye adwuma je so fa no ne kwaso. Communication with your doctor, pharmacists, and nurses is also key to help you understand, to help you stay on course. And send you kind of trust this system. Na pill boxes. Ubetuma top pill boxes or CVS or Walmart. No arrange running in some Monday and you're taking in no arrange. To do Monday we are winning the offer. Pill boxes is very effective. And now fence no betim so often no be brabet much chem na every time what take it down at the same time. It is maybe 2 o'clock na be offer or listen for blood pressure. Every 2 o'clock offer blood pressure. And a mobile app and Obia use a smartphone. There are so many apps. Ubisa Dr. Boatina and I say Dr. Yentumia. Umbetumi Boa setting up, MediSafe, Mango Health, Run App, My Med. These are all up on your smartphone now. Ebetumi Boa am organizing medication setting up. The last thing I'm passing minimum can NSA. I was say a GSA system in Eddie. Now the entire was the NSA. a doctor for tatahwe wo wi ase nyina no eya koyese ha no mo Canada for baha Africa for the omu nyina nkom beba ha other countries ni nyina enya bibia ye eso omu de ba US ha eninti sa system a ye wo mu no mum ye njindi na me pese me ka asem kakra bi ede hye wo nkuna de enti a e wase ye gi sa system idim se wo kodo doctor ho na doctor no hwe ono ma waduru a doctor no waben unipadua na ekuta ne nsem omo nim bibia unipadua nte se language o speaki omo enim bibia babia dompe bia se omo nim omo abin yie nanso doctor no mfa ne tirim ena ma waduro no doctor no eyusu enoma bi ansa no make decision enti aha ne yefra bibi evidence based medicine eno no practice wa ha we compare that to our country Ghana and also Africa a word of mouth medicine no practice akuase ofa aduro we no ni sisi ni ye enti kwa me wo so fa usisi ni be ye word of mouth no evidence. This is the country nyankopon nam na dum so ede waba evidence based medicine a kire say ansa na doctor ne ebe ye decision say wo odi say aduro we be ma for evidence and research ayeni wiase nyina yetum se wani adura ye de ma we yeye eninti na evidence na ye research nyina agina faako ekuta doctor no. Now the patient specific clinical circumstance enunso gina faako and a doctor no ne knowledge ni suko akoya 15 years no 14 years of training and any experience ni nyina nso gina faako saa no ma nyina behia and saa decision na oye no ehyem finfin. How can you be wrong? Well, you can, it happens, but compared to ours back home, I'm not trying to criticize the way they practice medicine there, but what I'm saying is, if you are here, this is where you have found yourself. This is the evidence. Womushaso ansana ya di adronama. Enti ansana adron be ma na wiase nyina giatum. Na ya fa wo patients wo simfinfin. Now all these circles are around you. Ansana ya make decision. Enti it's not a lot of knowledge and a lot of effort has gone into it. Ansana wo patient no what benefited. The clinical experience of the doctor and the evidence and your specific circumstance all come together in order to practice evidence-based medicine. And this is what is done here. Every hospital, every doctor, every pharmacist, we practice and make decisions based on the evidence. Now the take-home message Mede Maone say, so for medication, very, very, very important. World Health Organization can say, I want to quote it, was say, increasing the effectiveness of adherence intervention may have a far greater impact on the health of the population than any improvement in any specific medical treatment. This is very strong. Was say let's say adherence, say yes, fair medication, your fun is a chain be beer make me the improve here. So hospitals near SEO, say doctors or it doesn't matter. Say bet me improve on many perfect medication. The benefit benyano a chance say yes to hospitals be brave. A chance say yeah for doctors, your doctor tatabiao. Nina be shia say you be fair medication. Someone who chain na dasona a chain na ho odin yi. Now so chain na ho odin nyina ejina link ba ko a eni ahodin. I will say it in English. What is the strength of this chain? It depends on the weakest link of the chain. Into hospitals na one any doctors no any patient no a chain and a susoyemu. It is you who determine the strength of that system. Enti sana ibinum kind of say medication adherence is the weakest link between the healthcare system. If we can break this code, we have the code to a healthy living. Thank you for the opportunity. Thank you, everybody. I hope you got something out of this presentation. Thank you.
Yo, Dr. Asare, that's I think that ene yenya addition emu dupa na there was some few minutes for questions. Eno Sadre no ebebie atum for questions. Na answer na obi beba so no so obi de obi post to a question bi ewo chat no na me read it. Or say, Doc, why take a medicine that manages one condition but more than 10 side effects?
Okay. So the side effects, no.
I'm say for the sake of ABA Muayen Brofono Aya Yikakrano. Since a question on say, identicra na say, me kofa a duro, I best side be a yareba could be a hammer. Knife a chin on my benya hunts and so I would obey it.
Okay. So the question, the answer to my question is we do not live in a perfect world. And what it is that say, nyame boy no nanka boni ni wiase nanka we live in perfect health. Enti senka aduro bi kra na ye kofa sa aduro no ebeye ade ba akopɛ na ade ba akopɛ ene beye. But when we are giving a medication now, we look at the side effect also. The question is which one, what is the risk and benefit? That is the point I'm trying to make. So obenya breast cancer, but for breast cancer drona obenya stomach upset ama sebesebu akọ private. So do we leave the patient to die with the hair and no diarrhea, or we try to get rid of the breast cancer? So we are not in a perfect world, but we try to get the best out of what we do. So the side effect is not something we can get rid of it. But what is the risk and the benefit? The side effect, if that is the case, then probably not. Because no baby doctor betting the amount about on farm because of the risk and the benefit. But we'll refine it based on the evidence, based on our fetal profile, no so they said do not amount. You near dry any side effects. A drobia our side effect, but some side effects, it's not significant enough for us to say any problem now with the bias.
Yeah, that's it. Pacho, before for our hobby.
Yeah, mpasa me bisa question kakra.
Pacho mama men so.
O can be say good RS. Just say ABR insurance one for we drama wa if say ABR sika 70 no obetumi akọ good RS ma omo de omba ma nhihye ya no omba hihye na omba ma na mpasa me hu say edru a good RS de be ma and the insurance ma no the same because obi ka say good RS edru ye fake tim mpasa me hu ni kura wo but that's
okay. All right, but you me answer na.
Wait.
Okay, so Onuya Asma may kind of say there's nothing like fake medication. So when we get medication in a pharmacy, we scan it through certain system, and the system clears it. If you are here in the US, if you are in Ghana or other developing country, I cannot speak it. I mean, of course, if you are outside, I won't use good arrest. So probably you are here. That is not true statement. It is absolutely incorrect. There's nothing like fake medication because you're using good arrest. Good arrest is the same exact medication insurance. Pharmacy in Chim, according to insurance, say where a cash, where a good I know. There's nothing like that. So what do you US here they are, and I can bet 100% say it's not fake. It's the same thing you get.
Medasi.
Pacho na men sa osro. Pacho me suma se bisa ne say
Yama odro esem prensa dakro. Prensa dakro no menom anopa no nsia. Na manom awia dumienu na manom anwumre no nsia. Me pa cho no eye. Anase was 24 hours na me wo no. E na me chemu miensa no edi nuro no ehhye. Me pese time no. Yaka se mprenu dakro. Metumi anom anopa no nsia. Na menom awia dumienu. Ana awia no nan a na chese manom mprenu no. Pa cho mihan chirechiremu kakra.
So onum no said the Osika and one no. So onum no ebia 4 hours and after 3 hours in between there, and then you are going too far. But anywhere from 6 to 10 hours, you are just fine. Okay. Into onum no 6 in the morning. I understand your question. Say be 3 times a day, every 8 hours. Into onuma any that crown also sorry sound no. Onum said you see no na and as so bit me spacing a little further, maybe you take back on ABR 6, 1, 8. That's fine, but this is just okay.
And in no free 6 hours, a biamenom na etimi 6 hours na menom de ene enye
Yeah. 6 hours is about the cut line, yes.
But say ko ba se bia one no 6 no akwa no no be say 10 and 11 no de enye.
And more, yes.
But you me that say.
Oh, sure.
Yo, Doc, if I show so ebusa a question or chat and was say, thank for the presentation. What do you have to comment about the conspiracy theories about how the system is rigged by Big Pharma? Encrophobia, adwin bi say, companies omo ye nru no, omo afa kwatikwan bi so, say bia eduba bia beto omo no benye skanti no omo afa kwan so ma bia doctors trade nru encropho left and right. Bibisa.
Okay, so correct. Say that is there. That possibility is there. But I personally don't think it can influence them a little bit, but not to the point to say, so we have the koya obema a draw for it. That is not the point. But a bit me influence so kakra, say be a draw your classes in TBA. Obet me move from one class to the other, the same thing by ABA. Because of influence, yes, influence. The pharmaceutical company can influence prescription. But what I'm trying to say is that it's not enough for them to give you wrong medication for your situation. It probably can give you medication and the cost and by high in that aspect, yes, but not enough to influence them to treat people bad, and I said to treat people with wrong medication. And clear.
Okay, that's it.
Mbacho, the obisa question.
We dem Mbacho be refi ba ko bi adenti na doctors ni nim say hahama ene nnuane bi tumi boa ema yare bi asitimi tu anase eko na chenchina de ebe ma ye side effect no a na de bia wo mo chiro ma ye.
Okay, so mpacho mame de hahama no eye wugidie ena kire wo saa hahama no nso e wo side effect de entie hahama no wo side effect nse so okogana wo mutimi ka cho se aduroi unom a wani so nyina beti kama wo sisimu nso ebeti na wokoda wo befrim fifire na afrim fifire ni wie a wo betimi asan didi ade na ba ko na wokope na ye main side effect. The other ones na enya the other coil ni nyina side effect. Hahaban yo enya hahaban yo ebia was side effect. Okay? Enti it just a belief system say hahamano any side effect. It is not true. Na hahamano kwa na was side effect because woman na umba kuno umutimika yare be 30 for one medication. And the reason it is say no na umye no hano they say a kwa woman say ko 90 kwa woman and come chiro de atia side effect no kra na eba onipadua no abrofo design aduro na will be any part doing was a question. Na kwasha apem bibi na saa de na ahinhim na no so akoka bibi na bibi akoka bibi na effect bi aba enti krom edu no mo ye no tokro na was a question mo nipadua no wo mo try so mo pipa ho e man be almost perfect na so nya perfect kwasha saa tokro ma keka bibi enti akeka bibi no eno na ede ho nsunso an friend side effect no na ye krom ha ma na mo kan de nobody refines it. Enti kwa ebo bibia. Enti in fact, if that is what you are saying, yeah, the side effect no, okra na yemo. Say enkrofo bibre enom hahaban for diabetes. Mbacho uti masem no. Enti e believe the ugidie no, it doesn't mean say that is true.
Yeah.
Let's say Mr. say. Enganka pressure de no, ese no na ba kopeda ayi. Dakro no say 8 o'clock wa. Manom 8 o'clock. Ade achi no 8 no me ye free ye manom nam kono ne ten asa enye adwuma.
Mbacho what say now was on them say 8 o'clock. Ebeye adwuma. Normally so pa say beka be 4-6 hours am do the next dose ne dia. And they was skip way and 6 hours was skip way. They move so funny 8. That's all funny 10, 11, and yeah, it's fine.
Okay. Dr. Patrick, so question in the chat, I say pharmacy branded medicines, and I say brand medicines tends to be pharmacy brand medicines tends to be less expensive. Are they equally effective? Like as a store branded medications and compared to the bigger name brands,
they are all yes. So basically what it is, they say in no almost yet it said the mature book. Say mature book now who say me Dr. Asare and I say Ken Asare din was what. No mature no masanya. Say book no ewo ho. Okay? Say book no ho. Say mature me take be 10 years and I'm the trade book no. Me publishing research and me am the trade book no it take many years. Say Dr. Abuatin Baso be a photocopier. On go through the same process and I me call in 10 years no or fire no the call photocopy machine no akọ photocopy. Because of that no time na or the enya copy no maybe 1 hour. You see the 10 years. And to be on the 10 years I had there and will be on the 1 year I had the same photocopy, the same book by just a photocopy. Course no one benye you say Dr. Boatin dey almost when free and the boss will ton e be obeton sa photocopy beton ba ko be 10 cents but me am your original na me year research na me bibia no me ton be $100 enti e the same book kan anti ase na the same bibia change na ba ko your original me na me original research no the other one the exact photocopy. Enti no edro bia be hu say a Walmart brand o say a CVS brand it's the exact same photocopy of the original. Enti in all aspects the same.
Okay, yeah, that's it. Say yambrenti if our last question. Say obi e wo hono mo ansana e de dwumade na ba wie. Say time no aso.
Pacho mapeja mensa. Ye fa me ma. Yo me da CP doctor ya do asepa mebo abaso eye no kure abibiduro eye ye no ne beto ye nananom no mu ye adwuma nanso ewa the side effect no eye wo asidan e chen abrofuduro ena nso measurement ni
exactly
ya de wo so ne nipa tiatia kurama nanso abrofuduro ye de bema wo a ye hwe weight ye hwe years awanya ye bisa ayi allergies awowo ansa na ye de aduro ya ma enti wonu aduro no a doctor ni ye sure say betumi aboa ye bibiduro nso eni ho saa kura bibia enti se ba se nya bad effect was to etumi help especially ye na ye diabetic nko for that ye say bibiduro we say de ye tatahwe wonu ya ayi hasi kire yare ye wo mo jam nyina abekwa anso nya no kure aduane a wudie no and created this problem. And do who did the year and between your bassa? Me was be a dad and some so often or some ama. You say, a drone tattery or coy and the man I can find by. Oba wa anye nipa bio no odi awu ayesie no. Enti ye ne ye diabetic no. Mum ye ntie de doctor se ka kire ye no. Ubi bia ka kire wo doctor ntie de obi beka. Mudi acha enu se wunu doctor ho no. Won kodo na o kidney asai na body organs no na wasɛ. Enti ne ankrofo quack doctors no ye kan mamuntie. Bile bi etie o primary doctor de obeka kire na yes a wo benyi na kire.
Amen.
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 Yeah, that's it. Say ebreninti ha na yede dwumadie no ebeba na wieye. Efa sa kwanya nso ada Dr. Asare asepa ye megidi ye se na adesua odi amaye no say e ka say ye charge a enka say enka ebo no ebe den pa but Kristo nti anwumre ye nya no free enti ye bese na yase nyame se onhyira no na onkoso a ema no sa nimde no na afi ontimi mfa nimde no bi so emwa ne community anase nipa atwa ne ho ahia.
Amen.
Ebra ansana yebebo empire etwato na yede dwumadie no aba awieye no e kai se nyame adom a ochina enso another one enso eba ochina the same time ochina Dr. Prince Ochre say myocardial infarction anase heart attack se enadie no se de hu se sikoye no enu kwan se ka cho se ochina nso mu be du sa nti ebesere muma ye nyina na ye invite afoforo na mra ene yaba amana efe mehwe numbers na nipa ewo so pa amana efe nti ochina ye mra ma na yefe nyame ya adom a ye maame ye sister Charlotte Ampa ochina be moderate amaye Elder Christian Wusu be bompa ya amaye ye mba na natufo be kan scripture na amaye na ye nua na ye baketo Abigail Frimpong e the theme song no amaye enunti no sabre no ebesre se osofo ewo so a bebompa ye ehira so amaye na se bibi wo ho na mpenfo nso announcement bi wo na omode beka ho na afi mode asoso amaye medamas
Medasi doctor for now the announcement bi no na me asedania de ma wo mo a abaso no nyina mo amwo other countries amabaso no megidi yesa ye mamon kokwa bebia na ebaso a ebeba moden ye yemu akire sasa the past no ehu se ebi free Ghana mo try siripe ebaso ebi free Europe ebi no wo Australia area honomo any other states munyina mobile radin shira munyina some me bom abaso na monto aso na pomoden ayade a ehia kase
yes amen
ya ano no na de wosusu nyina ka wotrim boye mama ya mompaye eda wase onyame tumfo edi ntrom a wobo onipa no na ode apomoden ho hihye ma na didie mu onomu sebeya na environment mpo woye in such a way sa ebema na hodene in that perfect state mpo boni aba na ebrei mu na esese ya pomodene ya hwe niam yiye na nam health department iso ma Dr. Asare ene wobia no ade amayen enura ye yare ye de amayen ahweyi esa ye yo eja yesra wo sa wodumu mistakes ayaye no in the past no fa chayen adwene ahodo ayenya eye negative no already fa ho bane chayen
amen
na ye won kwa ne wade ti brabe boa yen na wotwi yentimi ntoa so ntiew ne bia through adesua yi no na ye save yen lives ye dia kasafo ni nyina hya won sase titru Dr. Asare na wode ni adwuma hoden a wahwere hye na namu
amen
na wode amai ontoa so mfema afoforo bre biara ye befre no wo mo aka nyina se de na waye to aso na fo mo ye anadwi ye kwakodai awrade ye sraw de oyare we mu biara fansato no so ma yenya hodene na de akyi a yasan aba betoa so atie o yenim se watie yen na mo sefo ne nye ne ope wa be ye ne apa ma yesanse yebisa awo nyame agya nyame oba nyame hon konkro de monti amen
Amen. Amen.
Amen.
Amen.
Amen. That was ready.
Asomedu, Kumasi New Road, SDA Church. On any year anti-comfort, almost say eradi was said that you
friend, Yami, a topic and I'm assuming friend. What a jaw did me one for fee. One more bosom, Yami, Uba mini cheese, Emmanuel Sida.
Anyway, you are there. Second, you are too much. And coming to your sea. Or do you think, Namma me to make it come in? You must sit down. You might hear me to me. See what do you anyway, second, you are too much. And coming to your sea. Or do you think, Namma me to make it come in? You must sit down. You might hear me to me.
Papa Deja, and the Jimasa, that was so. Oh, you quiet there. I feel to us, but you was it,